think the estimate is another 750,000 appointments are being restricted, as they say. But certainly Professor Sir Stephen Power is saying this particular stoppage is going to have more impact than any other.
Well, yes, absolutely. And the reason for that is the role that consultants play within the NHS. OK, they're on strike, but it does mean that junior doctors, who are not on strike at the moment, have very little to do because they rely very heavily on those consultants to guide them and improve what they're doing. And we're finding that many junior doctors, nurses as well, are finding there isn't much to do today. As you say, thousands and thousands of appointments have been cancelled, or postponed rather. I spoke to a gentleman who sadly wouldn't come on camera, but he was saying how angry he feels because his wife has had 3 operations that have been postponed in the last few months. One because of a nurses' strike, one because of a junior doctor strike, and now one because of the consultant strike too. Well, there was a picket line here very briefly this morning, only from 9 till about 11 o'clock this morning, but I did manage to catch up with the consultant and I asked him why he feels it's justified in these times to go on strike.
It is not just the strike, but it's also the capacity to deliver with a lack of infrastructure. And the most precious infrastructure is the staffing. So, we have waiting lists that have been growing and growing. It is not because of the junior doctors or the consultants. We've only started we're taking industrial action recently, but it has been a long problem because of the lack of staff, lack of infrastructure. The problem is that there is only so much one person can do, or 2 people or 3 people. It's the government, from the top, who need to invest and understand that if doctors are trying to work to make sure that they can pay for childcare, pay for their mortgage, clear their debt, the NHS as such is going to be stretched to the bone.
Well, talking to people in Bristol this morning, it's very evident that the public support for this strike isn't as strong as we've seen in the past. Many people have been saying, well, look, their starting salary is well over £90,000 and that could rise to £120,000, albeit they say that it takes them 19 years to get to that level. That level is still possible. And you were saying just before I came on air about their pension pots and the increases they're getting to that. So I think it's fair to say here in Bristol that there isn't quite the support for this strike as there was for the nurses' strike and the juniors' doctors' strike earlier on this week.